Health experts say the key to reopening communities safely is to provide widespread testing that can be easily accessed at your doctor's office. The state says it currently has the capacity to test 3,000 people a day for the coronavirus and is expecting that to expand to 5,000. But as state officials announced the new higher testing capacity, South Dakota's testing numbers suddenly dropped off over the weekend, going from 678 tests on Sunday to 101 on Monday. KELOLAND's Angela Kennecke has been looking into the number of people tested, why it dropped, and what the future of testing should look like to get back to business.
The highest number of South Dakotans were tested early on in this pandemic. On March 26th, there were 1,159 new tests in South Dakota. That number went up and down until Smithfield was declared one of the nation's top hotspots on April 9th, bringing new tests over the 700 mark last week. So why did they suddenly drop to 101 on Monday and 237 today?
We did see very aggressive testing when we had the cluster in Minnehaha County, so you may have seen an inflation in the testing numbers for that reason.
We typically see a fewer tests being performed, I think, over the weekends.
The South Dakota State Medical Association wants to see an overall increase in testing available of both symptomatic and asymptomatic patients. Do you think people can easily get the test today?
No, I don't think it's available, and you know that is part of the problem. Is at this point, at least in our state, that we're somewhat limiting who should be getting the tests, and so you know the more vulnerable patients, the patients who are symptomatic, healthcare workers, we're all being somewhat careful about who gets a test because of the availability of supplies.
Under the White House testing plan unveiled this week, each state would have to get enough tests to screen at least 2% of residents. But a Harvard paper says that figure should be as high as 21%. The South Dakota Department of Health does not anticipate that would be a problem.
The capacity is there to meet the need, whatever that need may be. And if that's 21% of the population, that may be up to 21% of the population. But at this point, we have not exceeded our capacity within the state.
The national testing plan says states should have a downward trajectory of positive tests or a downward trajectory of documented cases over 2 weeks. South Dakota's most recent dramatic dip may or may not be the start of that trend.
I do anticipate that we're going to continue to see numbers increasing as individuals are contacting their providers, and as we have a focus of increasing testing capabilities within the state.
The South Dakota Department of Health says it's looking into more testing for employees and residents of nursing homes across the state. Dr. Sommer says many nursing homes are already requiring new patients be tested before they be admitted.